when the world thought the war was almost over. October 1918, World War I was finally nearing its end. After 4 years of trench warfare, artillery bombardments, poison gas, and unimaginable destruction, millions hoped peace was finally coming. But while soldiers were still fighting in Europe, another enemy was spreading across the world. Invisible, silent, and far deadlier than many realized. The influenza pandemic of 1918, later known as the Spanish flu, had already infected huge portions of the globe. But in October 1918, the virus reached a level of devastation unlike anything modern society had seen before. In the United States alone, around 195,000 Americans died during that single month. To this day, it remains the deadliest month in modern American history. And the truly terrifying part was this: doctors barely understood what was happening. Part 1. The second wave became a nightmare. The flu pandemic had actually begun earlier in 1918. The first wave appeared relatively mild compared to what came later. Many patients recovered quickly, but then the virus mutated, and by late summer and early fall of 1918, a far more lethal second wave exploded across the world. This new strain spread rapidly through military camps, ports, factories, and crowded cities. World War I unintentionally helped accelerate the disaster. Troop ships carried infected soldiers between continents. Military camps packed thousands of men into tight quarters. Railroads and wartime mobilization helped the virus move faster than authorities could contain it. By October, major American cities were collapsing under the pressure. Philadelphia became one of the worst examples. Despite warnings from medical experts, the city had allowed a massive Liberty Loan parade in late September to support the war effort. Hundreds of thousands attended. Within days, hospitals began filling with flu patients. Soon, the healthcare system completely broke down. Part 2. When cities stopped functioning. The scenes described by witnesses in October 1918 were horrifying. Hospitals ran out of beds. Doctors and nurses became sick themselves. Medical supplies disappeared. Emergency facilities were opened in schools, churches, and public buildings. In many cities, there weren't enough coffins. Undertakers became overwhelmed. Bodies sometimes remained inside homes for days because funeral services could no longer keep up. Mass graves were dug in certain areas. Entire families became sick simultaneously. In some households, no healthy person remained alive to care for the others. The speed of the disease shocked everyone. Many victims seemed healthy in the morning and dead by night. Some patients developed severe pneumonia. Others turned blue from lack of oxygen because their lungs filled with fluid. Doctors described patients bleeding from the nose and mouth. One physician later recalled seeing so many bodies stacked together that the images haunted him for the rest of his life. Fear spread everywhere. People avoided handshakes, churches closed, schools shut down. Public gatherings were banned in many cities. Masks became mandatory in some areas, but even these measures often arrived too late. Part 3. Why October 1918 was so deadly. One of the strangest and most terrifying aspects of the 1918 flu was who it killed. Normally, influenza is most dangerous to the elderly and very young, but the Spanish flu disproportionately killed healthy young adults between roughly 20 and 40 years old. The exact reason is still debated today. Some scientists believe many victims died from what's called a cytokine storm, an extreme immune response where the body essentially damages itself while fighting the infection. Ironically, stronger immune systems may have made some young adults more vulnerable. World War I conditions also made everything worse. Malnutrition, exhaustion, overcrowding, and stress weakened millions of people physically. At the same time, antibiotics did not yet exist. Doctors could do very little for patients who developed bacterial pneumonia after influenza infection. Medicine in 1918 simply wasn't prepared for a catastrophe on this scale. Even basic understanding of viruses was extremely limited. Many people still believed influenza was caused by bacteria. There was no vaccine, no antiviral treatment, no effective cure. Communities were fighting a global pandemic almost blindly. Part 4. The government struggled to control panic. Another major problem was information. World War I censorship affected how newspapers reported the pandemic. Governments feared that bad news would damage wartime morale. As a result, many officials downplayed the severity of the outbreak. Ironically, Spain, which was neutral during the war and had a freer press, openly reported on the epidemic. Because Spanish newspapers covered the outbreak extensively, while other nations suppressed news, many people incorrectly assumed Spain was the source of the disease. That's how the name Spanish flu became popular. Meanwhile, public health officials faced enormous pressure. Some cities acted quickly and imposed restrictions. Others delayed, and those delays often proved catastrophic. Philadelphia became infamous for reacting too slowly. St. Louis, by contrast, introduced restrictions earlier and experienced significantly lower death rates. The pandemic became one of history's clearest examples of how timing during outbreaks can determine survival. Part 5. The emotional terror of the pandemic. What made October 1918 especially traumatic was the feeling that death was everywhere. Unlike war, there were no battlefields to avoid. The virus entered homes, schools, workplaces, military camps, and hospitals alike. People lived in constant uncertainty. Parents feared their children would die overnight. Children watched parents disappear within days. Doctors worked until they collapsed from exhaustion. In many places, daily life almost stopped entirely. Businesses closed because employees were too sick to work. Public transportation slowed. Garbage collection sometimes failed. Even essential services struggled to continue. And psychologically, the pandemic created a level of fear few generations had ever experienced. The world had already endured 4 years of global war. Now disease seemed to be finishing what the war had started. Some communities genuinely feared civilization itself might collapse. Part 6. The pandemic finally began to slow by November 1918. World War I finally ended, but the flu pandemic continued. Additional waves appeared in 1919 and even beyond. Globally, the death toll eventually reached at least 50 million people, though some estimates are even higher. In the United States alone, around 675,000 Americans died. And yet, despite its enormous impact, the pandemic was strangely under-discussed for decades afterward. Partly because World War I overshadowed it. Partly because many survivors simply wanted to move on from years of death and trauma. But historians today increasingly recognize how profoundly the pandemic changed society. It reshaped public health systems, influenced future medical research, and revealed how vulnerable modern civilization could become during a global outbreak. October 1918 remains the darkest moment of that crisis, a single month where death arrived faster than cities could respond. The month the world couldn't escape. Death October 1918 was more than a public health disaster. It was a moment when millions of people realized how fragile civilization truly was. Technology had advanced, empires ruled vast territories, modern cities seemed powerful and unstoppable, yet a microscopic virus brought entire societies to the brink of collapse. Hospitals failed, governments struggled, fear spread faster than information, and for one terrible month, death became part of everyday life. Today, more than a century later, October 1918 still stands as a warning from history. Sometimes the deadliest threats humanity faces are the ones we cannot even see.